Uh, Thank you, Mr. Chair, and I'd like to thank all of our witnesses for taking time to come to testify before the committee today. Ms. Desikan, in the report that is filed with us today, I found it interesting that you used an example, or you cite an example of what you think or what the Union of Scientists think is political interference through agencies, and you cite that an HHS scientific expert filed a whistleblower complaint stating that in January and February of 2020, HHS officials sent HHS workers to Wuhan, China without any proper infectious disease training or personal safety equipment. So do you recall at the time when the WHO declared COVID-19 a pandemic?
I don't know the exact date. I think
Let
it was
me give you
February,
the
March.
exact answer. The exact answer is March 11th. So I find it interesting that there would be a whistleblower complaint, and it's probably why it didn't go anywhere, that at the time, the WHO was still denying that there was human-to-human transmission of COVID-19. And in fact, when many of us, I as a physician and former director of the Department of Public Health, thought the pandemic should have already been called, didn't even consider it a pandemic or an epidemic, until March 11th. Mr. Dodaro, I'd like to take a moment to make sure we have clarified specifically what your report does and does not lay out. To conduct your work for this report, how many individuals from HHS did GAO interview?
I'd ask Ms. Wright to respond to that, please.
Congresswoman, we had a multi-part methodology. So we spoke with 16 employees, either managers or staff, and conducted semi-structured interviews with them. And that's how we got information about what, if any, observations they had with regard to scientific integrity violations. In addition to that, we had several other interviews where we spoke with former agency heads of FDA, CDC, for example, and we also spoke with current agency officials in various program offices across those four agencies.
Correct.
We also, excuse me, Candace, you might want to explain the confidential hotline that we had as well.
Thank you for that. So I should mention, with regard to the managers and the 16 managers and employees whom we spoke with, we did provide them confidentiality assurances that information that they shared with us would be appropriately protected. And so with regard to the examples that we have in the report, it is at a high level because of if any specificity about of those observations could risk disclosing their identity.
Thank you. And so does your report make any specific findings regarding whether these complaints did or did not constitute political interference, Mr. Dodaro?
No, that was not part of our objective. No, so no.
So what I'm hearing is that you didn't find for certain that there was political interference. What you found was that the absence of specific procedures may explain why the agencies did not have formally reported internal allegations.
That's correct. That's correct.
Well, thank you for clarifying that. I think we can all agree, and I'm a physician and a former director of public health, that political interference of any kind should not be tolerated. Mr. Chairman, that's why I wish we could hold a hearing on clear political interference we saw during this administration, wherein the CDC went directly to the teachers union with guidance. We should also be discussing this administration's choice to create confusion and bypass the CDC and the FDA's long-established vaccine advisory committee process for boosters. The GAO found that from 2010 to 2021, none of the four agencies within HHS, CDC, FDA, NIH, or ASPR had a report of political interference. Do you recall if anyone, Mr. Dodaro, if anyone at the CDC had felt and was so concerned about political interference that they resigned?
I don't recall that. Candace, do you?
I'm not aware of anything like that.
Yeah. Well, this administration announced the availability for vaccine boosters for all adults before the CDC and the FDA finished reviewing the data to determine if this was necessary. And in fact, in contrast to feeling political interference that's been brought up, two FDA officials left the agency amid reports of political interference, saying that they were concerned about politics interfering with the process. And I have a report that I would ask for unanimous consent to be submitted to the committee.
Without objection.
So I'll submit that to you. Thank you so much, Mr. Chair. I yield back my time.